Eli Lilly says Zepbound medication, there's Zepbound medication, more effective than Wegovy. The drug maker recently conducted a study comparing the two weight loss injections, and it says it found that those taking Zepbound lost 47% more weight than those who received Wegovy shots. Joining us to talk about this, it's Dr. Bill Hartman, the clinical trialist at UW Health. Doctor, great to see you. We've had so much Eli Lilly news today with their big expansion announcement in Kenosha. But let's talk about this study because it's making waves. Can we trust a study done by the drug company saying, hey, our medication's the best?
That's always a very good question to ask. However, I don't have any reason to really doubt the results from this study showing that patients lost more weight, or participants lost more weight when they took Zepbound versus its competitor Wegovy. Zepbound is actually a combination of two medicines. One of them has the same GLP-1 type agonist activity that Wegovy does, but it also has another compound in there that stimulates that simulates another hormone called GIP, which helps with sugar and fat breakdown. And so these two together probably put people in a place where they're going to lose more weight than with Wegovy alone.
My takeaway, the insane amounts of weight loss that these drugs were found to have done to people. I mean, we're talking Wegovy 13% weight loss and Zepbound 20% weight loss in people?
Right. These drugs are truly medical miracles. And for people who need to lose weight for certain medical conditions, they really make a tremendous difference. The other take-home thing is that whichever one is covered by your insurance company is going to be fine. You're going to lose weight. These drugs do work very well, and they will work for you.
You're not just going to lose weight, you're going to lose a lot of weight. Hey, speaking of insurance, some breaking news on the insurance front. Anthem Blue Cross Blue Shield, a lot of people have that, reversing course on a controversial decision that would have had patients, it would have forced them to foot the bill if their surgeries took too long. Tell us what happened here.
Well, what they had done is they said that there is going to be a time limit on surgery procedures, and once that time limit is met, they weren't going to pay for the anesthesia services any longer. That bill would be passed on to the patient themselves. But as we all know, those of us, I'm an anesthesiologist, I certainly have my own biases here, but anyone who works in an operating room knows that there really is no time limit on a surgery. It takes as long as it takes to get it done right. And so we can't put any sort of compromise on patient safety, on optimal patient outcomes, or on best practices. And the best practice is to have your anesthesia team there to make sure that everything goes safely for that patient while the surgeon is operating and making sure that their anatomy gets put back together correctly. This was a decision now where they've reversed that, and which I really think is the only decision that they could make in the name of patient safety.
Well, what was scary about that is the insurance company saying, you know, this surgery should take, I don't know, 2 hours. This surgery should take 3 hours. The insurance company is saying that. Is that common practice?
Not common practice, and it's actually, you know, it's very difficult to predict. No surgeon goes into a surgery knowing exactly how long it's going to take. They don't know until they're looking with their own eyes on what's going on inside the patient, and so it's very difficult to predict what the timing of these procedures is going to be. And obviously, you need anesthesia the entire time that the procedure is going on. And so, again, this is, you know, the only decision that really could have been made to ensure that patients receive the care that they need in the safest way possible.
Glad they reversed it. You know the best part about the anesthesiology, talking to an anesthesiologist here? You have no idea how long that surgery took. It could have been 5 minutes. It could have been 10 hours. You just wake up and it's over. Dr. Bill Hartman, appreciate your time.
Thank you.